everyone, good day. By the way, I am Daryl Emmanuel Vichua, a student nurse of Section D. Did you know that a lot of diseases arise due to lack of time of people to do personal hygiene? Almost all of the bacterial or viral infection develop because people tend to disregard the importance of doing it. Therefore, let's always instill in our minds and our hearts the importance of personal hygiene. And in this video, I'll be performing giving a patient shampoo in bed. But first, what is the definition or meaning of this? It is cleaning the hair and the scalp of the patient by removing the oil and dirt present in the hair with the use of shampoo while the patient is on the bed. And what are the purposes or objectives or rationale why perform such activity? First is to cleanse the hair and the scalp of the patient and improve the well-being of the patient. Second is to improve the circulation, and last but not the least is to prevent infection. Okay, the next step that we will be doing is we need to gather all the needed materials in order for us to perform such activity. Okay, let me show you the materials needed. Of course, we need to have our 70% rubbing alcohol in order for us to disinfect our hands to avoid cross-contamination among our patients. And we need to have a shampoo, which is the most important thing because we're able to perform or we cannot perform such activity without shampoo. So, we also need to have a glove. This is very important for us to be hygienic. And I also have here a cotton balls, or 2 or 3, it depends, but needed is only 2 cotton balls enclosed with a container. Okay? We also need to have our paper waste receptacle where we're going to put our waste later. We also need to have a comb, and by the way, this comb is from our patient, so this is the patient's comb. We also need to have a 1 washcloth. Okay. We also need to have a urinal. This is for male. We also need to have an emergency basin, and of course a bedpan for the female. And by the way, guys, we also need to have towels. We have 3 towels in order for us to perform such activity. Okay, let's put this back. Okay. And of course, we also need to have a pelly pad. Since I don't have a pelly pad, I just use a sack as an alternative. In today's generation, we need to be resourceful. So I just use a sack as an alternative of the pelly pad. Okay? We also need to have a pail because this is where all of the liquids or the water will be poured out. And under our pail, we should have a paper lining. Okay, I think I've already shown you all the needed materials in order for us to perform such activity, which is giving a patient shampoo in bed. And now let's proceed to the proper procedure. Okay, the first step that we'll be doing is we need to check doctor's order, or we need to ask permission from our physician to do shampoo in bed, to make sure that shampoo in bed is not contraindicated to the condition of our patient. And yep, I've already asked permission from our physician a while ago. The physician agreed that shampoo in bed is not contraindicated to our patient. And the next step that we'll be doing is we need to identify or determine what type of shampoo will be used for our patient. And our physician agreed that this type of shampoo is suitable to our patient because the patient doesn't have any allergenic reaction if we're going to use this type of shampoo. So yep, this shampoo is suitable to our patient, and the physician agreed to use this type of shampoo. The next step that we'll be doing is we need to assess the manifestation of fatigue to our patient, the level of consciousness, and of course what type of personal hygiene we'll be doing to our patient. And if the patient doesn't have or have any health problem. Okay, let me show you. Okay, sir, good morning. By the way, do you feel tired or do you feel fatigued or do you have fatigue today?
No.
Okay, our patient responded that the patient doesn't have any fatigue. And going to the next step, level of consciousness. So our patient was able to answer my question. So the level of consciousness of our patient is good. So our patient is conscious. So the patient doesn't feel fatigue or doesn't have fatigue, and our patient is conscious. And the next step we'll be doing is we need to assess the hair of our patient. Okay, as I checked, our patient doesn't have any scalp problem. So now let's proceed to the next step. Okay, the next step is determine the need for assistance. So as I assess, I don't need any assistance. I can handle the situation. Okay, the next step is we need to gather all the needed materials. Since I've already gathered all the needed materials, now let's proceed to the next step, which is we need to identify the patient and explain the procedure. Okay, sir, good morning. By the way, I am Darrell Emmanuel Bichua, your nurse assistant for today. And by the way, may I know your name, please?
My name is Alfredo Veloces.
Okay, thank you so much for that, Mr. Alfredo Veloces. So our patient's name is Alfredo Veloces. Okay, by the way, what we're going to do today is shampoo in bed. So basically, shampoo in bed is cleaning the hair and the scalp of the patient to remove the dirt and oil present in the hair with the use of shampoo while the patient is in bed. So why we perform this activity, or what is the purposes, or are the purposes why we perform the activity? First is to cleanse your hair and scalp, and also to improve your well-being. Second is to improve your circulation, and aside from that, it also prevents any infection. So everything is clear, sir. Do you have any questions or clarifications before we proceed to the next procedure?
No.
Okay, thank you so much for that, sir. Now let's proceed to the next procedure or step. The next step that we'll be doing is we need to remove any accessories present in the hair of our patient, like pins, wigs, or clips present in the patient's head or hair. Since our patient is male, our patient doesn't have any wigs or hair, so which is good. And the next step that we'll be doing is we need to provide privacy. So we need to close all of our windows and of course screen for us to provide any privacy to our patients while doing such activity. And the next step that we'll be doing is we need to adjust the level of the bed. So let us assume that the bed is already at the proper level of position. Since my bed is not adjustable, let's just assume that it is already in the proper level. And now let's proceed to the next step. Okay, we also need to wash our hands, to disinfect our hands, and to also remove any dirt or any bacterial or microorganism present on our hands to avoid any cross-contamination among our patients. And yep, since my hand doesn't have any heavy soiling, what I'm going to do instead of washing it with soap and water, I'm going to do a 70% rubbing alcohol. Okay, disinfecting your hands is very vital, very imperative to avoid any cross-contamination to our patient. And of course, if you're just doing 70% rubbing alcohol, you also need to do it in a proper way, like the way you wash your hands, the strokes that you will be doing. Okay, I think I'm already good with disinfecting my hands. Yep, I've already disinfected my hands. The next step that we'll be doing is we also need to put gloves in our hands to avoid any infectious materials present in our environment. So gloves is very important. And in this video, I'm going to show you how to put on proper gloves. Since I've already put my gloves on, the next step that we'll be doing is we need to offer a bedpan or urinal for our patient. Since our patient is a male, we need to offer a urinal because in order for us to avoid any interaction while doing the procedure. Okay, sir, I'm going to offer you a urinal. Would you like to pee or pamihi?
No.
Okay, great. Since our patient doesn't want to, pamihi, now let's proceed to the proper procedure. Okay, we also need to remove or put away our bedside table away from the head of our bed, so that if we're going to perform the activity, we will not be interrupted. So it would be a smooth flow while performing the activity. Okay, I've already removed the bedside table away from the head of our bed. Okay, now let's proceed to the next step. We need to prepare the patient for shampoo. We need to remove the top linen to the waist and position a back blanket over the patient. Okay, what we're going to do is we need to remove the pillow from the head of our patient. Okay, sir? I'm going to get the pillow. Okay, now, thank you so much for that, sir. Okay. You may now lay down, sir. Okay, lay down. Okay. Since we've already removed the pillow, and you need to set aside the pillow from the other side of the bed. Okay. And next thing that we'll be doing is we need to get a towel. And by the way, guys, you need to make sure that the right side of the towel will be touching the patient. Okay, great. And the next step that we'll be doing is we need to position the patient diagonally. Okay, sir, I'm going to position you diagonally so that while we're doing the procedure, it would be not hard for us to do so. Okay, sir? Oh, it's okay, just lay down. Yeah, thank you so much for that. Okay, very good. Yep. Very good. Okay. The next step that we'll be doing is we need to put a rolled blanket or a rolled towel under the patient's neck. So for us to provide comfort while doing the procedure. Okay, sir. Up a little bit. Okay, so that. You now lay down. And after that, guys, you also need the other towel. This towel will serve as a covering so that our linens will not get wet while performing the activity. Okay. You need to, and also guys, this blanket or towel should be at the shoulders of our patient and as well as the head for us to also, will be beneficial while we're going to do the procedure as we go on to the next step. Okay, thank you so much for that, sir. Just a little bit. Okay. Very good. Thank you so much for that. Make sure that it is properly positioned. That is very important. After placing a towel into the patient's head and shoulder with an end of the towel coming together in front, what we're going to do next is that we're going to put a rubber sheet or a sack as an alternative. Since I don't have a rubber sheet, I'm just going to use a sack into the head of the patient, extending to the receptacle of the water, which is our tail. And don't forget to put a paper lining underneath our tail. Okay? Alright. Let us position our rubber sheet for our scalp to be placed under the patient. Okay guys, and make sure to really put or position your rubber sheet, or if you don't have a rubber sheet, to tap or any kind of alternative in a proper way so that the water won't spill into our linens. You need to remember that. Okay, what we're going to do next is we need to comb the hair of our patient using his comb. So this is his comb. It is hygienic and sanitary. And don't forget that if you get a tangled hair or any dirt coming from the head of the patient, you need to put it in your paper waste receptacle. That's the purpose of your paper waste receptacle. So we comb this for the hair of our patient in order for us to get the tangled hair present in the patient's head or hair. Okay, after combing the hair of the patient, put this to the table. And what you're going to do next is you need to get your cotton balls, remove it from your container, and get one and place it into the ear of your patient. So we perform this step in order for us to prevent the water that we're going to do later on to enter to the patient's ear. That is the purpose of this cotton balls to be put to the ears of our patient. And the next step that we're going to do is we need to put this face towel or this clean towel, small towel, into the patient's eye to prevent from the water to enter to the eye of our patient. Okay, sir? Would that be okay if I'm going to put this into your eyes?
No.
Yes.
Oh, yeah.
Oh, yes. So our patient just misunderstood a while ago. So our patient really said yes. Okay, I'm going to put it, sir. Okay, put it in a position that our patient would be comfortable, as well as to the ears. Okay, after putting a washcloth into the patient's eyes and of course a cotton ball to our patient's ear, what we're going to do next is that we're going to shampoo as follows. So the first thing that we're going to do is we need to get our hot or warm water with a 43 to 44 degrees Celsius. And by the way, before applying it to our patient's head, you need to test it for yourself. Okay, so our water is okay to be put or to be poured out to our patient's head. So what we're going to do next is you need to slowly pour warm water over the head of our patients until completely wet. Okay, we need to pour. Okay, sir, I'm going to pour, sir. Okay. So I've already poured enough water, so the hair of our patient is already wet. The next step that we're going to do is we need to get enough soap for applying small amount of shampoo rather to the patient's hair. Okay, so we're going to apply a shampoo. And of course, work up a ladder with both hands and start the client's massage. So massage the head of our client. And by the way guys, you also need to shampoo the sides of the head of your patient as well as to the back. So what you're going to do to the back is that you're going to lift the head of your patient in order for you to also include the back hair of your patient. So sir, I'm going to lift a bit, just a little. Okay, that's good. Thank you so much for that. Okay, apply the needed pressure. Don't forget to also include the scalp of the patient, not just the hair. Okay? Do circular motion in order for you to really get through all of the portions of the head of your patient. And by the way guys, don't forget to really put a paper lining beneath the tail. That is very important. You need to massage it so that to increase scalp circulation and to also prevent infection like what I said a while ago. And by the way guys, another thing is your fingernails should not scrape the scalp of your patient. Just use this, the soft one, not the fingernails. Okay, the next step that we're going to do after doing a good lather into the hair of our patient as well as to the scalp is we need to pour, again, rinse it with warm water. Okay, sir, I'm going to rinse your hair with warm water again. Since we're already done shampooing. And by the way guys, by doing this, you also need to be careful. And you also need to take into consideration the welfare of your patient. So make sure that your patient is comfortable with what you're doing with him or her. Okay, so again, let's thoroughly rinse it. Okay, we're already done rinsing it with warm water. And what we're going to do next is do the final rinsing with cold water. Why is this so? Because rinsing with cold water, it causes constriction of pores of the scalp of our patient. So this is a tap water, again, not literally cold, but tap water. Also for the patient to feel refreshed because it's not that hot. Okay, very good. And what you're going to do next is we need to set aside our pitchers with the cold and warm water. And by the way guys, don't forget that if the hair of the patient is still dirty, even though you've already performed it, it's okay for you to repeat the procedure if you're going to wash the head of the patient. It's not a big deal. After giving a final rinsing with cold water, what we're going to do next is we need to squeeze the the excess water from the hair of our patient. Okay? You also need to squeeze. After squeezing it, you also need to remove the earplugs present to the ears of your patient. And put this earplug to your paper waste receptacle. And the next step that you will be doing is you need to remove the rubber sheet, or since we don't have that, we're using a sack, and then remove the earplug like what I said a while ago. Also the this one, the towel that is on the side of our patient. Okay, sir, I'm going to get rid of this. Okay, you may now lay down, and I'm going to get this. Thank you so much for that, sir. And put this or set this aside. What you're going to do next is that you will put this, set that aside, and then pull the towel around the patient's shoulder so that you can dry the hair of the patient. Okay, sir, I'm going to pull this, but it's okay. Don't stand up. It's okay. You may. Okay, very good. Thank you so much for that. And then just lay down, sir. And then dry the hair of the patient. You can also use a hair dryer if the patient really insists to have a hair dryer, to use a hair dryer in drying his or her hair. Okay, make sure to really get rid of all the water. Okay, next step that we're going to do is to replace pillow protected with dry towel. This one, we're going to position this. Okay, sir. It's okay. You may now. I'm going to assist you for your comfort. Very good. Thank you so much for that. And remove this. And also, if you are to remove this, make sure to put it back the way it is. And set this aside. As well as this one. Okay, the next step that we're going to do is we need to comb or brush and arrange the hair of the patient and leave bath towel under the head. And you need to leave this until the hair is completely dry. Okay? Comb the hair of the patient with necessary direction. Are you able to comb your hair, sir? Or I'll be the one to do it? Yes or no? Okay, since the patient said that I'll be the one to comb his hair, yeah, I'll be combing his hair. Okay. And the next step that we're going to do after combing it is we need to place the patient in a comfortable position. Okay. Okay, sir, are you comfortable with your position?
Yes.
Oh yes, okay, so our patient is comfortable with his position. Okay, since the hair of the patient or of our patient is already dry, we need to replace the bath blanket, which is this one, with top sheet linen, which is the under one. Okay, sir, I'm going to remove the hair. It's okay, I'm going to assist you. You may now lay down. Lay down, sir. Yeah. And make sure that the patient is in the comfortable position. Okay, sir, are you comfortable with your position?
Yes.
Okay, very good. Thank you so much for that. And of course, like what I said a while ago, you also need to put this or your towel the way you get it for it to be in an orderly position. Okay, what we're going to do next is we need to wash our hands. We need to remove this. Okay, I'm going to remove my gloves. Okay. Okay, very good. And then put this into your paper waste receptacle. I'm going to wash my hands with soap and water. Since, like what I said a while ago, instead of washing, I'm just going to do a 70% rubbing alcohol. If you were to do the 70% rubbing alcohol, you also need to, the strokes that you'll be doing is just like the way you wash your hands. And it would be better if you were to sing the happy birthday song while doing this, so that you can really have the guide to the time range while performing this. Okay, the next step that we're going to do is we're going to do the aftercare. Okay, we're going to do the aftercare. So we're going to do the aftercare. So basically, we need to bring the equipment to the utility room or to the storage room where we get the equipment. And aside from that, we also need to return it to the proper places. And of course, we need to wash and rinse the patient's comb, which is this one, if we are to do the aftercare, and return it to the bedside of our patient, so that if the patient wants to comb his or her hair, it would be accessible for him or her. And aside from that, you also need to place the used linens into the linen hamper, so that the utility or the one who is going to clean it or wash it would be accessible for them, that this is already a used towel. And also, we need to wash, rinse, and dry the rubber sheets. Since I don't have a rubber sheet, I just use a stuff like this one. You need to dry it and any other things that you've been using, and you need to return them to the proper places, like what I've said a while ago. Okay, I'm already done the needed procedure or step, like what I've said a while ago. I've already put the linens back to the wash run and all the needed equipment back to its original place. What we're going to do next is we need to evaluate our patient. We need to watch our patient carefully for any signs of fatigue or tiredness, and evaluate as to comfort and cleanliness. So, okay, sir, are you feeling good with the procedure?
Yes.
Okay, are you feeling tired or any fatigue?
No.
Okay, so like what our patient just said, our patient is in good condition while performing the activity. Our patient doesn't feel any tiredness or any fatigue, so which is a good thing. And the next step that we're going to do is the documentation. We need to record the procedure done or any assessment that we've done to the patient. And we also need to report problems if there are any problems that are noted. Okay, you need to record it, which is very important because you're going to give this to the physician, like what you have just done to the patient, and of course, if there are any problems that just happen to the patient. Okay, record it. So our patient doesn't have any complaints or doesn't feel any tired while performing the activity. And we've done shampooing in bed to the patient completely and accurately. Okay. So, thank you so much, sir. By the way, again, like what I said a while ago, I am Darrell Emmanuel Beach, your nurse assistant. Thank you so much for being my patient today. And by the way, guys, this is my Lolo. So thank you so much, Lo, for attending and for helping me to be able to fulfill this activity. And also to you guys, thank you so much for watching. I hope you're all doing great. Have a wonderful and blessed day ahead. Thank you so much.
Ci parli, man.